Today's lecture will be on the heart's conduction system and its cardiac cycle. When we're looking at the heart conduction system, we have to remember that the heart conduction system is an autorhythmicity system, which means that it's responsible for its initiating its own heartbeat. When we're looking at initiating its own heartbeat, we're usually looking at an impulse being started from the sinoatrial node or the pacemaker of the heart, anywhere between 70-80 beats per minute. Some important aspects when we're looking at the location of the SA node is it's located in the posterior wall of the right atrium. It does have the ability through internodal pathways and the gap junctions of the myocardium or the cardiac cells to propagate evenly into the left and the right atrium. What we also see is that the SA node is under parasympathetic intervention, which means that it can be slowed down, or the rate can be slowed down also. So when we're looking at the initiation of the heartbeat and the SA node, we then travel down to the atrioventricular node. It's located in the floor of the right atrium. Its function is to slow the conduction of the impulse from the atrium into the ventricles. So we have the SA node firing into the AV node, slowing down the conduction of the impulse to the AV bundle. So the AV bundle, also known as the bundle of His, sits inside of the intraventricular septum. It is then going to branch in the intraventricular septum to the apex of the heart. So when we're looking at the left and the right bundles, once it hits the apex of the heart, then we consider this to be the Purkinje fibers, and the Purkinje fibers are going to propagate into the left and the right side of the myocardium and innervate the action potential into the cardiac cells. When we're looking at the overall propagation, we can see here that the SA node has already fired across to the AV bundle and across to the right atrium. Again, remembering that the right and the left atrium are going to contract in unison. The action potential is then going to travel down the atrioventricular bundle, or the bundle of His. It is going to then propagate along into the apex, into the Purkinje fibers, and once it hits into the Purkinje fibers, we'll see the right and the left ventricle contracting in unison. So since the SA node is contributing to 70 to 80 beats per minute, what we see are two different types of cardiac plexuses that are innervating. We know that the heart is innervated by the autonomic nervous system, and it has a sympathetic and a parasympathetic intervention, also called the cardiac plexus. This has the ability to speed up or slow down the different types of heartbeats. So the first one that we're going to be looking at is the sympathetic. It's the cardioacceleratory center. This cardioacceleratory center is located usually in T1 through T5. So the initial cardiorespiratory or cardioacceleratory centers are coming from the spinal cord. So the steps are going to be that the spinal cord is going to contribute first to the sympathetic preganglionic axon. These are located anywhere between T1 and T5. These enter into the preganglionic sympathetic trunk. So we can see here how it goes through the sympathetic trunk, and it's going to ascend into the cervical or thoracic sympathetic ganglion. So this would be considered our preganglionic And then once we enter into the sympathetic ganglion here, this would be considered to be the post-ganglionic axon. So around this area here is where we're going to have the synapse between the pre and the post. So once it enters into the postsynaptic axon from the cervical ganglion, what we're going to see, it's going to travel and it's going to land on two destinations. It's going to hit the SA node. It's going to also enter into the AV node, which is going to increase the rate or the heartbeat. And it's also going to come down into the ventricular system. So it's going to come down and innervate into the ventricles, which will cause an increase of force of contraction, which will increase the amount of blood flow exiting the heart. When we're looking at the parasympathetic intervention, it's going to be starting, it's called an inhibitory center. It's going to be starting in the medulla oblongata, preferably on both sides, so the left and the right side. It is the cardio-inhibitory center is portions of the cranial nerve 10 or the vagus nerve. So with the cardio-inhibitory center is located in the medulla oblongata, what we see is that once these are initiated, you can see the termination points are going to be in two places. It's going to terminate in the SA node and it's going to terminate in the AV node. We do not see it going into the ventricular side of the heart. So since it's only hitting the AV node and the SA node, we can say that it decreases or can decrease or inhibit heart rate, but it has no change in force of contraction. So the only places that we'll see change occur is through decreasing heart rate, but it's not going to change anything with ventricular contraction. So when we look at the cardiac cycle, some important notes when we talk about a full cardiac cycle is going to be the first part is when we see ventricular diastole, or when we see the filling up of, go back up here, ventricular systole. So when we're looking at the cardiac cycle, the beginning of a cycle begins when the atria contract. These next two slides are going to show what the difference between ventricular systole and ventricular diastole. And mostly what we're looking at are the opening and closing. So during ventricular systole, what we see is that the aortic or the semilunar valve will be open and the pulmonic valve will be open. So when we're looking at ventricular systole, we're particularly looking at the contraction of the ventricles. You can see that the mitral valve or the AV valve here and the tricuspid valve are closed, as this is showing here. So the tricuspid and the mitral valve are closed, and we see the aortic and the pulmonic semilunar valves are open. So during ventricular systole, we're going to see blood flow exiting to the lungs, and we're also going to see blood flow exiting into systemic circulation. When we look at ventricular diastole, what we're seeing is that we're going to have the filling of the ventricles. So diastole means that when we're in relaxation or when the ventricles are relaxing, we're going to see the blood entering into the right and the left atrium. So this is coming from the lungs, this is coming from systemic circulation. And we're going to see the opposite effect. We're going to see that the tricuspid valve on the right side is open, the mitral valve on the left side is open. So we have blood flow that's allowing to travel across into the ventricles. And then of course we're going to see the pulmonic and the aortic valves closed, as this is illustrating. So when we look at the contraction cycles, what we see again is that all contractions or one full repetition of the cardiac cycle begins when the atria contract. Remembering that the right and the left side are always going to contract in unison or at the same time. When we're looking at the overall cardiac phases, there's just a few key points that we should touch upon. So when we're seeing the different valves are opening, so here when we're looking at atrial contraction and ventricular filling, is we see that the tricuspid and the mitral valves have been opened. The atria is contract, so the SA node has sent its signal over to the left side of the heart. And then we see a unison contraction or contracting at the same times to fill the ventricles. So isovolometric contraction, this is what's going to give the lub sound when we're looking at heart tones. But the lub sound comes from once the ventricles are filled, we see the tricuspid and the mitral valves closing or shutting, which gives in the heartbeat the lub sound. So at this point, we see that the ventricles, after they are going to be filled, are going to begin, due to the amount of pressure building up from the filling, we're going to begin to see the ventricles beginning their contraction. So right now we have the atrium that are empty and the ventricles that are contracting. So at the initiation of contracting, what we see is that, again, the AV nodes, the tricuspid and the mitral valve will be closed. And we're going to see the two valves, the aortic and the pulmonic valves, are going to open during contraction. So these semilunar valves here are going to be open. We're going to see blood flow entering into the lungs and blood flow going out into systemic circulation. Once the ventricles have contracted, what we see next is the atrial relaxation or the filling. So again, we're going to see the semilunar valves of the pulmonic and the aortic valves. They are going to close. We're going to see blood entering in from the superior and inferior vena cava, and it's going to begin to fulfill the atria. At that time also, what we see is that the tricuspid and the mitral valves are open to begin the ventricular pre-filling. Once it has hit its maximum filling or isovolometric pressure, what we see is that the atrias, or what we're going to see is that the valves will then close. So at the first initiation of filling, we get a pre-fill in the ventricles, and then what we're going to see is the tricuspid and the mitral valves are closed, which is going to increase the amount of blood filling into the right and the left atrium. So you can again consider this when the valves are open, it's a little bit of a pre-fill. The valves close here. Once the valves close, then what we're going to have is the blood flow is going to increase into the left and the right atrium. And during that isovolometric relaxation, we're then going to come back up and we're going to see the SA node firing across and beginning the process of contracting into the ventricles. So this is just a normal blood flow or a pathway system when we're looking at how blood enters in. So blood is entering in from the superior and inferior vena cava. We go through the right atrium, goes past the right atrioventricular valve, or what we call a tricuspid valve, to the right ventricle, to the pulmonic semilunar, through the pulmonary arteries. Remembering arteries are going to have blood flow flowing away. We see oxygen picked up or carbon dioxide distributed, coming back to the heart. So anything that goes towards the heart is considered a vein. Into the left atrium, into the left atrioventricular valve, which is also called a mitral valve, to the left ventricle, through the aortic semilunar valve, through the aorta. And then once it exits the three branches at the top, the brachiocephalic, left common carotid, then what we see is it'll enter into the systemic arterial system, which then will have an exchange of gases and nutrients in the peripheral tissues. So this is just a general pathway for blood flow through the heart. And thank you, and that ends or concludes the heart conduction video, and we'll talk soon. Thank you.